guys, it's me, Professor D, and welcome back to my channel. On this video, I'm going to be covering peripheral vascular disease. If you haven't done so already, guys, please don't forget to like and subscribe below. I'm also now on TikTok and Instagram, so be sure to check my other social media platforms. The content that I cover is going to be different on there than what I cover here, so it'll be extra studying time for you. My handle's still the same, Nexus Nursing. Also, I now have audio lessons available, so if you're struggling in a certain subject, you have a test coming up, and you just really need some pointers, be sure to check that out. Go to Nexus Nursing Institute, and you scroll down, and you'll see audio lessons, and just pick whichever subject you want an audio lesson on. I've got plenty of content, and every week I'm uploading new content, so if you don't see what you're looking for today, keep checking because every week I upload new content. All right, guys, so without any further ado, let's get started. First question. The nurse has finished receiving the morning change of shift report. Which client should the nurse assess first? 1, the client diagnosed with arterial occlusive disease who has intermittent claudication. 2, the client on strict bed rest who's complaining of calf pain and a reddened calf. 3, the client who complains of low back pain when lying supine in bed. Or 4, the client who's upset because food doesn't taste good and is cold all the time. Let me adjust my camera, guys. Okay, guys, and the correct answer is 2, the client on strict bed rest who's complaining of calf pain and has a reddened calf. Why is this the answer? Why? We're suspecting the client has a what? DVT. And deep vein thrombosis, isn't that life-threatening? Can't that, number 1, cut off circulation to the lower extremities, and that patient might possibly have to have that extremity amputated? Can it, number 2, dislodge, go to the lungs and turn into a pulmonary embolism? This is life-threatening, so that's going to be our priority, guys. When we look at our other choices, yes, we're going to go and assess the patient, see what's going on, but it's not life-threatening like choice number 2 is life-threatening. This patient's life is in danger, so we're going to assess that patient first. Remember, guys, whenever you get a question that's asking you about priority, who are you going to see first? Who are you going to assess first? You have to choose the patient whose life is in danger the most, okay? Don't forget physiological integrity. Everything that falls in Maslow's hierarchy of needs as far as physiological integrity, what's keeping that patient alive, or what will prevent them from dying the fastest, that's always going to be your priority. Okay, guys? Next question. The nurse is caring for clients on a vascular disorder unit. Which lab data warrants immediate intervention by the nurse? 1, PTT of 98 seconds for a client diagnosed with DVT. 2, hemoglobin of 11.4 for a client diagnosed with Raynaud's Phenomenon. 3, WBC of 11,000 for a client with a stasis venous ulcer. Or 4, triglyceride of 312 in a client diagnosed with hypertension. And guys, the correct answer is 1, the PTT of 98 seconds for a client diagnosed with DVT. Well, guys, the therapeutic level is supposed to be 1.5 to 2 of the normal level. Look at this, 98 seconds. Well, what's that normal? 39 seconds. So guess what? This is way too high. So what does that mean? That means that this patient's at risk for bleeding. This is life-threatening. Bleeding, fluid and electrolytes, ABCs, vital signs. These are things that keep the patient alive and can potentially kill them, right? So absolutely, that patient hemorrhaging to death, that's a life-threatening situation. So that's going to be our priority over our other choices. Yes, these other patients need to be addressed because the hemoglobin of 11.4, that's a little low, right? This patient is slightly anemic, but that's not life-threatening like the patient that's at risk for bleeding out. Choice 3, WBC of 11,000. Well, the normal is 5 to 10. So yes, that's a little high. That patient needs to be assessed, but they're not in danger like that patient that's possibly bleeding out. And then number 4, the triglycerides are high. Yes, we need to assess that patient because, you know, with high triglycerides, heart disease, all that good stuff, but their life is not in danger like that patient who's about to bleed out. Okay? So that's why number 2 is a correct answer. Next question. The unlicensed assistive personnel tells the nurse that the client has a blood pressure of 78/46 and a pulse of 116 using vital signs machine. Which intervention should the nurse implement first? 1, notify the doctor immediately. 2, have the UAP recheck the client's vital signs manually. 3, place the client in Trendelenburg's. Or 4, assess the client's cardiovascular status. And guys, excuse me, you know, whenever I'm in the studio, my nose runs. I don't know what I'm allergic to. All right, guys, the correct answer is 4. Assess the client's cardiovascular status. And guys, this is a rule of thumb across the board. Let me tell you something. Whenever you get a test question, it says somebody comes to you, whether it's a UAP, whoever it is. If somebody comes to you to tell you something abnormal about your patient, the next thing you're going to do is go assess them. Don't send them back to do anything for your patient. That patient is your responsibility. Whenever something abnormal is happening and they come and run to you to tell you something about your patient, you run back to that patient and you assess that patient for yourself. Rule of thumb across the board. So number 4 is the correct answer. You're going to check the patient yourself. Look at these vital signs. Blood pressure, low. Heart rate, up. What's possibly happening? This patient's possibly bleeding out. They're going through shock. These organs are going to collapse on you, right? So you want to assess this patient yourself to see what's going on with them. The nurse on the vascular unit is preparing to administer medications to a client on a medical unit. Which medication should the nurse question administering? 1, vitamin K, a vitamin to a client with an INR of 2.8. 2, propranolol, a beta adrenergic to a client with arterial hypertension. 3, nifedipine, a calcium channel blocker to a client with Raynaud's. Or 4, enalapril, an ACE inhibitor to a client with a sodium level of 138. And guys, the correct answer is number 1, vitamin K, or vitamin to a client with an INR of 2.8. Okay, let me back up. If you go back to the question, it says the patient has an INR of 2.8. If that patient's INR is being taken, this patient's getting what? Coumadin. They're getting warfarin, right? Vitamin K is the antidote for Coumadin. So why would we be giving the antidote to a patient with an INR of 2.8? Does that make any sense? Absolutely not. So that's what you're going to question. Whenever you get a question asking you, what are you going to question? Which one would you clarify? What they're really asking you is which one's the wrong answer choice, and this is by far the wrong answer choice. Choices 2, 3, and 4, all of these are appropriate. Giving beta blocker to a client with hypertension, giving calcium channel blocker to a patient with Raynaud's, giving an ACE inhibitor to a client with sodium of 138. All of these are appropriate, but that number 1, you're giving the antidote for Coumadin to a patient with an INR of 2.8. You're going to question that order. Guys, you're not robots. You're not just going to give medications blindly. You have to use your critical thinking. So when you see that, you're not going to give that medication. You're going to withhold it and place a call to the doctor. Okay, next question. The nurses receive shift report. Which client should the nurse assess first? 1, the client with DVT who's complaining of dyspnea and coughing. 2, the client with Buerger's disease who has intermittent claudication. 3, the client with aortic aneurysm who has an audible bruit. Or 4, the client with acute arterial ischemia who has bilateral palpable pedal pulses. And guys, the correct answer is 1, the client with DVT who's complaining of dyspnea and coughing. What are we suspecting? Pulmonary embolism. Their physiological integrity is at risk. This is life-threatening. So that's who we're going to go to first, right? Choices 2, 3, and 4, yes, they need to be assessed, but those are not life-threatening. But number 1 is life-threatening. We're thinking this patient has a pulmonary embolism, and we're running to them first. We're going to assess them. Next question. The female client diagnosed with arteriosclerosis tells the clinic nurse that her stomach hurts after she takes her morning medications. The client's taking calcium channel blocker, a daily aspirin, and a statin. Which intervention should the nurse implement first? 1, assess the client for abnormal bleeding. 2, instruct the client to stop taking the aspirin. 3, recommend the client take enteric-coated aspirin. Or 4, instruct the client to notify the doctor. And guys, the correct answer is 1. The first thing you're going to do is assess that client yourself. You want to watch out for bleeding. Why? What do we know about aspirin? Aspirin puts the patient at risk for bleeding. Number 1. What else about aspirin? It's hard on the stomach. right? It can cause gastric ulcers, and those ulcers can start to bleed, right? That's probably why that patient has the stomach ache. So as a nurse, you would tell the patient, stop taking this medication, don't take it, go call your doctor. Yes, you're going to tell them that, but the first thing you're going to do is assess the patient, because you're going to have to place a call to the doctor. How are you going to give the doctor any information without assessing them, right? So you're going to check the patient, see if, and remember, assessing is not only a physical examination, guys. Assessment is anything that garners information. So just asking more questions, that's a form of assessment. So you're going to ask the patient, when you have a bowel movement, what color is the stool? Do you see any blood in the stool? Any blood in the urine? Have you vomited lately? If you did vomit, what was the color of the vomit? Are you bruising easy? So you want to also ask questions to see if this patient's bleeding. So when you call the doctor, you have something to say to them. Take the patient's blood pressure. Do you see that heart rate up? Do you see the blood pressure low? Do you see signs and symptoms of shock, right? So you are going to assess the patient. That's the first thing you're going to be doing. The nurse educator on the vascular unit is discussing delegation guidelines to a group of new graduates. Which statement from the group indicates the need for further teaching? 1, the UAP will be practicing on my brand new nursing license. 2, I will still retain accountability for what I delegate to the UAP. 3, I must make sure the UAP to whom I delegate is competent to perform the task. Or 4, when I delegate, I must follow up with the UAP and evaluate the task. And guys, the correct answer is 1, the UAP will be practicing on my brand new nursing license. The question said, which one requires further teaching? Whenever you see something asking you for which one requires further teaching, excuse me, what they're really asking you is which one's wrong. And number 1's wrong. This is a myth when you hear people saying, or students saying, or nurses saying, oh, this student's working under my license. No, they're not. Nobody works under your license except for you. The only person that works under your license and is responsible for your license is the person who's holding the license, no one else. Okay? Now, choices 2, 3, and 4 are absolutely appropriate, so none of those require further teaching. But the person who says that the UAP is going to be working on my license, no. UAPs don't work on your nursing license. Nursing students don't work on your nursing license. The only person who works on the nursing license is the person who holds that license. Remember, I told you that. Next question. The nurse is reviewing the literature to identify evidence-based practice research that supports a new procedure using a new product when changing the central line catheter dressing. Which research article would best support the nurse's proposal for a change in the procedure? 1, the article in which the study was conducted by the manufacturer of the product used. 2, the research article that included 10 subjects participating in the study. 3, the review of literature article that cited ambiguous statistics about the product. Or 4, the review of literature article that cited numerous studies supporting the product. And guys, the correct answer is 4. The review of literature that cited numerous, as in many studies supporting the product. Now let's look at our wrong answer choices. 1, the article in which the study was conducted by the manufacturer of the product used. Don't you think there's a conflict of interest here? So no, we're not choosing that one. Choice 2, the research article that included 10 subjects, only 10 subjects? How is that study going to be reliable when you only had 10 subjects? Absolutely not, that's wrong. Choice 3, a review of literature article that cited ambiguous. You know what ambiguous means? That means not detailed, not defined, ambiguous. So it's kind of like a gray area. Absolutely not. We want things that are black and white, right? Things that are clear and clear cut. So number 4 is the correct answer. You have many different studies that are independent that support the product. Okay. Next question. The nurse and the unlicensed assistive personnel are caring for clients on a vascular unit. Which task is most appropriate for the nurse to delegate? 1, providing indwelling catheter care to a client on bed rest. 2, evaluating the client's 8-hour intake and output. 3, giving a bath to the client who's third spacing. 4, administer a cation exchange resin enema to a client. I love this question, by the way. And guys, the correct answer is 1, providing indwelling catheter care to a client on bed rest. And they try to trick you by putting that catheter in there. That UAP, they're not inserting the catheter. All they're doing is catheter care. They're cleaning around that catheter, right? The UAP can do that. But let's look at our other choices. Choice 2, evaluate, stop. You can never delegate anything to an unlicensed assistive personnel, such as a CNA, anything that they have to EAT, evaluate, assess, or teach. If these three, you as the nurse, you have to keep, those type of patients. Only you can evaluate, only you can assess, only you can teach. Okay? So that's wrong. Choice 3. Look at how they try to trick you. Remember I told you all the time, guys, the first half of the answer choice will be beautiful, but you always have to read the whole thing because they'll try to trip you up sometimes. Look at number 3. It says, give a bath to the client. Yeah, of course, UAPs can do that. They can do that all day, every day, right? But let's keep going. It says, give a bath to the client who is third spacing. Excuse me? This client is third spacing? That's life-threatening. You are going to be caring for this client. You're not going to have that UAP doing anything for that client. Not giving a bath? Absolutely not. You see how they tried to trick you, because you'll just see give a bath and want to choose it right away. But guys, you have to read the whole answer choice, because I'm telling you, I used to be one of them. I know how these test writers think. They will give you a beautiful answer. They'll start it off beautifully and not finish it. Okay, so that's wrong. And then you have the last one, administer cash and exchange resin enema. That's a medication. UAPs can't do that. You as a nurse would be administering that. So that's wrong. So the correct answer is them doing indwelling care, and really they're just cleaning the perineal area around that catheter, okay? The nurse asked the female UAP to apply SCDs for this, to a client who's on strict bed rest. The UAP tells the nurse that she's never done this procedure before. Which action would be a priority for the nurse to take? 1, tell another UAP to put the SCD on the client. 2, demonstrate the procedure for applying SCDs. 3, perform the task to apply SCDs to this client. Or 4, request a UAP watch a video demonstrating this task. And guys, the correct answer is 2. This is your UAP. You're going to be responsible. Remember, you're responsible for what you delegate. You have to make sure that that UAP is competent in what you delegate. And you have to always follow up with whatever you delegate to make sure it was done and it was done appropriately, right? So you're going to teach her how to do it. And then after it's done, you have to come behind her and check the patient, make sure that it was placed on the patient correctly. Okay, so the correct answer is 2. The nurse in the vascular critical care unit is working with an LPN who was pulled to the unit as a result of high census. Which task is most appropriate for the nurse to assign to the LPN? 1, assess the client who will be transferred to the medical unit in the morning. Excuse me, guys. 2, administer a unit of blood to the client who's 1 day post-op. 3, hang the bag of heparin for a client diagnosed with a PE. 4, assist a doctor with insertion of a client Swan-Ganz line. And guys, the correct answer is going to be 3. That is the only thing that LPN can do on this list. LPNs are allowed to give medication. They're allowed to give IV medications, right? Now, they can't do pushes, but they can give IV meds. They're allowed to hang meds, okay? Remember, when it comes to LPNs, you always want to give them the most stable patient, number 1. And number 2, you'll want to always delegate something that is within their scope of practice. Now, let's look at our other choices. 1, assess. I just told you, if you are the RN, you have to keep the EAT, evaluate, assess, and teach. Now, I want to clarify this for you guys, because LPNs do teach. They teach their patients all the time. However, the initial teaching is always done by the RN. The LPN comes behind the RN and they'll do the follow-up teaching. But that teaching, the assessment, the first assessment is done by the RN. The in-depth assessment is done by the RN. The LPN comes behind the RN and they can do follow-up assessments, right? But that is the responsibility of the RN. So number 1, assess the patient. Wrong. That's the RN, right? And let's say you didn't catch that. Let's keep going. It says assess the client who will be transferred. Excuse me. Patients who are being transferred, do we give them to LPNs? No. Why? Because patients who are being transferred, and also it doesn't, even if they're being transferred to another unit or they're being transferred home, there's a lot of what? In-depth teaching, in-depth assessment that's involved. So the RN has to keep patients that are being transferred. Okay? So even if you didn't catch the first part where it said assess, you should have caught the second part where it said transfer. They gave you 2 clues to let you know that's the RN and not the LPN. Second choice, administer a unit of blood. No. That patient that's getting a unit of blood, they're not stable, right? And I'm teaching from the state of Florida, guys. I think there are 2 or 3 states where LPNs can give blood, so check your state. But generally speaking, LPNs don't give blood. The RN is responsible for that type of patient. So we're not going to keep that. And then choice 4, assisting that doctor with the insertion of that Swan-Ganz. That patient is not stable, right? So the RN is going to keep the patient. Remember, the LPNs only get the most stable patient. They get the most stable patient because the LPNs are doing what? Giving routine meds. Those patients who are not stable, they require in-depth assessment that only the RN can do. Next question. The nurse is administering 1 unit of packed RBCs to a client. 15 minutes after initiation of the blood transfusion, the client becomes restless and complains of itchiness on the trunk and arms. Which intervention should the nurse implement first? 1, assess the client's vital signs. 2, notify the doctor. 3, maintain a patent IV line. Or 4, stop the infusion at the hub. And guys, the correct answer is number 4. Whenever you get a question about a patient getting infusion of whatever, I don't care if it's blood, medication, whatever, and the patient's having an adverse reaction, and in this question, we can tell they're having an adverse reaction. Look, the patient becomes restless. Why do you think they become restless? Often, when the patient's having a lack of oxygen to the brain, one of the first thing we see is a change in cognition, right? The patient's becoming restless, and they're complaining of itching on the trunk. We're suspecting that it's possible patients having an anaphylactic reaction. So the very first thing we're going to do is to stop what's harming the patient. What sense does that make? You're calling the doctor, hey doc, this infusion's killing my patient, but it's still going through the patient because I never stopped it. Does that make any sense? You're going to stop what's killing the patient first before you do anything else. So the correct answer is number 4. You're going to stop the infusion. Right after you stop the infusion, you're still not going to call the doctor. Call the doctor and tell them what? You didn't even take vitals yet. So you're going to stop what's killing the patient, then assess your patient. Get information so that when you call the doctor, you actually have stuff to tell the doctor so you can get orders. Okay? So the first thing you're going to do for this question is number 4, stop the infusion at the hub. The nurse calls the doctor for an order for pain medication for a client who's 2 days post-op aortic aneurysm repair. The doctor gives the nurse an order for Demerol 50 milligrams IV push now, and then every 4 hours is needed. What action should the nurse implement first? 1, write the order in the chart with the words per telephone order. 2, request another nurse verify the doctor's order on the phone. 3, read back the order to the doctor before hanging up the phone. Or 4, transcribe the order to the medication administration record. And guys, the correct answer is 3. You're going to read back the order to the doctor before hanging up the phone. So this is what you do, guys. When it's a telephone order, first of all, you're going to have another nurse there with you as a witness to hear it. That doctor is going to be on speaker. The doctor is going to give the order and you write down the order. Then you read that order back to the doctor and say to the doctor, is this what you ordered? That doctor says yes. You have that other nurse as a witness. Because let me tell you something. You give that med and it goes left. Family decides to sue. You better believe that doctor is going to throw you under the bus. And guess what? The facility is going to stand by the doctor because it's easier to replace a nurse than to replace a physician. You hear me? You're getting a telephone order. That doctor is going to be on speaker. You're going to have another nurse as a witness. The doctor is going to give the order. You write it down. Then you repeat it back to the doctor to clarify that this is what the doctor wanted ordered. Okay? So guys, the correct answer is number 3. Next question. A client on the vascular unit tells the day shift primary nurse that the night before that the night nurse did not answer the call light for almost an hour. What statement would be most appropriate by the day shift primary nurse? 1, the night shift often has troubles answering the lights promptly. 2, I'm sorry that happened and I will answer your lights promptly today. 3, I will notify my charge nurse to come and talk to you about the situation. 4, there might have been an emergency situation, so your light was not answered. And guys, the correct answer is 2, I'm sorry this happened and I will answer your lights promptly today. Now, after you say that to the patient, you can follow it up with, I'll make sure the charge nurse comes to speak to you about what happened, blah, blah, blah. But the first thing that needs to come out of your mouth is, I recognize your feeling and I'm sorry you feel that way. However, this is what I'm going to do moving forward. You bring the patient back to the here and now. Okay, yes, this happened last night, but I'm here now and this is how I'm going to help you. When you do that, you acknowledge their feelings and you also give them confidence in you because you let them know that you are going to do what you're supposed to do. So you let them know that you're sorry about how they feel and you're going to make sure you answer their lights. And then you can follow it up with, I'll make sure I get my charge nurse to come see you later so you guys can speak about the situation XYZ. You never make excuses for other nurses. You weren't there, you didn't know what happened, and another reason you never do that is because when you do that, you're putting the patient on the defensive. What do you think, I'm lying? Or, whatever it is, it doesn't matter. You never make excuses. You always want to bring the patient back to the here and now. They have complaints, you're going to address the complaints, absolutely, but you want that patient to know that right here, right now, I'm here for you and I'm going to care for you. Then you can follow it up with anything else, about how you're going to help them or have somebody come in to speak to the patient, okay? All right, next question. The nurse is preparing to administer a unit of packed red blood cells to an elderly client who is 1 day post-op abdominal aortic aneurysm. Which intervention should the nurse implement? List in order of performance. 1, obtain the unit of blood from the blood bank. 2, start an IV access with normal saline to keep open rate. 3, have the client sign the permit to receive the blood products. 4, check the unit of blood with another nurse at the bedside. 5, initiate the transfusion at a slow rate for 15 minutes. I'm just looking crazy tonight. Okay, so guys, I'm going to give you the order of how you're going to do this. The first thing you're going to do is number 3, have the client sign the permit to receive blood products, because guess what? If we don't have consent, nothing else matters. We're not doing anything else on this list, right? So we're going to get the consent. So the first thing we're going to do is number 3, get the consent. The next thing we're going to do is number 2. We're going to start an IV access with normal saline to keep that vein open, okay? The next thing we're going to do is number 1. We're going to get the blood from the blood bank. After that, we're going to do number 4. Check the unit of blood with another nurse at the bedside, because you give the wrong blood, you can kill your patient, guys. Okay? You're going to double check with another nurse at the bedside. You're going to be checking the whole label on that blood against the patient. Okay? And the last thing you're going to do, you're going to give the infusion at a slow rate for the first 15 minutes. Why? Because it's most likely the patient's going to have a reaction within that first 15 minutes. Okay? That's why we do that. Okay, next question. The female client tells a charge nurse that the UAP did not know how to take her blood pressure. Which action should the charge nurse implement first? 1, discuss the client's comment with the UAP. 2, retake blood pressure and inform the client of her blood pressure reading. 3, explain that the UAP knows how to take a blood pressure reading. 4, ask the UAP to demonstrate taking a blood pressure reading. You guys should all get this right because I just talked to you about this. So the correct answer is 2. You are going to take the blood pressure reading and tell the patient what it is. Now, that patient's concerns, we'll talk about that later, but you want that patient to know that you're there for them. Bring them back to the here and now. You take that blood pressure reading and tell them what it is. Later, you can assess the UAP, ask them to take a blood, not in the patient's presence, privately, ask them to take a blood pressure on another nurse so you can watch and see if the UAP knows what they're doing. You're going to address all of that later, but you're always going to bring the patient to the here and now You take care of them. You take their blood pressure, okay? Which medication is most appropriate for the nurse to assign to the LPN to administer? 1, IV push antiemetic to the client who's nauseated and vomiting. 2, sub-Q low molecular weight heparin to the client with a pulmonary embolus. 3, PO Trental to the client who has intermittent claudication. Or 4, sublingual nitroglycerin to the client who's complaining of chest pain. And guys, the correct answer is going to be number 3, the Trental to the client with intermittent claudication. Remember, when it comes to LPN, guys, you're going to give the LPN the most stable, most routine, right? So let's look at our other choices. 1, IV push. Can LPNs do IV push? No. So you're not going to give that to an LPN. 2, sublingual nitro to a client who's complaining of chest pain. If that client's complaining of chest pain, are they stable? No. So you're not going to give that to the LPN. 3, sublingual nitro to the client. Oh, I said that already. What am I missing? Oh, 2, the sub-Q heparin to a client with a pulmonary embolism. Is that stable? No, that's life-threatening. So the only stable patient, the most stable patient out of this whole list is the client that's having intermittent claudication, because at least that's not life-threatening as the others are. So that's what you're going to give to the LPN. Okay, guys, we are down to our last question. The clinic nurse is assessing a client who's complaining of right leg calf pain. The right calf is edematous and warm to touch. Which intervention should the nurse implement first? 1, notify the doctor immediately. 2, ask the client how long the leg has been hurting. 3, complete a neurovascular assessment on the leg. Or 4, place the client's right leg on 2 pillows. And guys, the correct answer is 1, you're going to notify the doctor immediately. What do you suspect is happening? Client has a DVT, and guess what? Can you give heparin without a doctor's order? No. So you got to call the doctor, tell the doctor what your findings are, so the doctor can give you an order for heparin, so you can get that heparin to the patient immediately. We suspect that this patient has a DVT. Now, right after you call the doctor, you get that order for heparin. You're going to give that patient the heparin. Then you can do number 4, which is place the client's right leg on 2 pillows. But our priority is getting that heparin to the patient, okay? This is a life-threatening situation. And guys, there aren't too many questions where you're going to choose call the doctor as the first thing you're going to do, because most of the time, there's at least one thing you can do before you call the doctor. But in this situation, with all the choices that were given to us, all you can do is call the doctor, because we need that heparin immediately. Guys, I hope this video was helpful to you. Please don't forget, if you're struggling with this or anything else in the nursing program, I have lots of audio lessons available on my website. The website is in my bio, but I'll tell you, nexusnursinginstitute.com. And I upload new lessons every week. So if you don't find what you're looking for, just check every week. New lessons are uploaded all the time. Don't forget to also follow me on Instagram and TikTok for more content for you to study. Guys, thank you so much for sharing this time with me and watching my video. Please do not forget to share my content with anyone you know that would benefit from this information. I'm really trying to get my channels to grow. I'm trying to do this for you guys full time. You guys got to help me out. Thank you so much for spending this time with me, and I'll see you on the next video.